So now we shall be discussing regarding the muscles of the medial compartment. Okay, we shall be discussing the medial compartment muscles. Okay, we shall be mainly focusing on the muscles of the medial compartment. Now regarding the muscles of the medial compartment, what are the important things you should know? Okay, so first of all, let me draw again the pelvic part, guys, and then I will explain you the muscles of medial compartment. Now all of you know what is this bone here? This is your sacrum bone. Okay, now this sacrum bone is all the way down in this way. All of you very well know sacrum bone has got sacral foramina like this. Okay, it has got sacral foramina, and important thing is that you have also got a very important foramen here. This is called as obturator foramen. What is this? This one is called as your obturator foramen. Here you have got your iliac bone. So this is how the pelvis looks, right? So this is not a correct picture, but anyways, so look here now. Here is your femur. Here is your femur. This is the head of the femur. Greater trochanter, lesser trochanter coming down all the way. Okay, and this is your femur over here, and this is your tibia all the way like this. Okay, this is your tibia. Now here one very important thing you need to know is that on the surface here medially we have got a small line which you can't see actually here. There is a small depression or line here. This is called as pectineal line. So what I am trying to tell you is that we have got a small line in the center here. This line is called as pectineal line. Okay, this is called as pectineal line. Pectineal line. Okay, now first important thing is that you have got a muscle. Okay, you have got a muscle from the superior surface of the pubic ramus. For example, look here. This is the pubic bone. Now in this pubic bone there are different kind of rami. This is called as the superior ramus, this is called as the middle ramus, and this is called as the inferior ramus of the pubic bone. Now I am drawing the superior ramus of the pubic bone. Now from this superior ramus of the pubic bone you have got a muscle, and that is attaching to this pectineal line. Look here, you have got a muscle, and this muscle is inserting to the pectineal line. So this muscle is called as pectineus muscle. What is this name? What is it named as? Pectineus muscle. This muscle is called as pectineus muscle. Okay, now next important thing is that from here little more anterior to the pubic rami, from here we have got another muscle that is attached all the way to the femur, that is attached all the way to the medial side of the femur like this. Now what is the name of this muscle? I'll tell you later on, but before that let me teach you another muscle. Okay, now what is this other muscle is that much more medially here there is another muscle like this that is coming all the way down. Okay, and if you can see, this muscle is little bit longer in comparison with the previous muscle. This muscle is little bit longer in comparison with the previous muscle. Okay, now look at the third muscle. For the third muscle what I'll be doing is that I'll be just drawing this part. Okay, I'll be just drawing this part, and I'll be drawing your femur bone over here because this is worth discussing. Greater trochanter, lesser trochanter, and all the way you come down like this. Here you have got the tibia. Okay, now look here. Now we have discussed that there was a muscle starting from the superior rami, that was called as pectineus, and next there was a muscle starting from this edge here. Now I did not name that muscle. There is a third muscle here down, right? I even did not name that muscle also. And but from the inferior ramus, now there is a muscle that is coming down. Look here. Now this muscle comes down all the way like this. Okay, now this muscle has got a partition like this, and it is going all the way up like this. Now look here, this is your entire muscle. Now who can guess what is the name of this muscle, guys? What is this name of this muscle? Yeah. First thing you have to know that all these muscles, whatever I'm drawing in the medial group, what is their function? I told you in the starting. Yes, what is their function? Their function is adduction. That is the reason why they are called as adductors. Okay, they are called as adductors. I have explained you this thing in the starting itself, right? So for example, here all the muscles are there, right? Now all these muscles are attached to the medial side here. Now when I am pulling these muscles, what will happen? My femur bone also will move towards the pubic bone, towards the center of my body. So this function, this action is called as adduction. Whatever is moving towards you, that is adduction, and whatever is moving away from you, that is called as abduction. Okay, so this will be adductors. Now in these adductors, we did not name three muscles. What are these three muscles? Now look here, this is muscle A, this is muscle B, this is muscle C. Now compare all these three muscles. Which muscle is small, which muscle is large, and which muscle is extra large? Now muscle A is small. So I should call that muscle as brevis, small in the sense brevis. But what function is it doing? Adduction. So it is called as adductor brevis. Okay. Now in the same way, let us look at muscle B. Now muscle B is little bit larger and longer than this, right? So I call it as adductor longus. Adductor longus. Now compare A and B with the C. Now C is also doing a similar function, but this muscle is very large and vast, right? So that is why very large muscles you call as Magnus. So it is called as adductor Magnus. Adductor Magnus. So in this way, how many muscles do we have, guys? We have got pectineus. Are these enough? Pectineus, adductor brevis, adductor longus, and adductor magnus. And there is also one more muscle, one last muscle, right? Now this muscle I'm drawing it with the green color to differentiate it. That's it. Okay. Now this always starts from the inferior rami over here. Now this muscle comes like this all the way. Okay. Look here. This is the muscle that is coming down, and it is attaching to your graceful legs, right? These are your legs. It is attaching to your graceful legs. So you call this muscle as gracilis. What is the name of this muscle? This is the final muscle. You call it as gracilis. So this is your gracilis. Okay. So in this way, how many muscles do we have? We have got pectineus, right? We have got adductor brevis, we have got adductor longus, we have got adductor magnus, and not only that, we have also got our gracilis muscle. So these are the muscles which you see in the medial compartment. So once again, medial compartment are called as adductors, that is fine. And what is the nerve that is innervating the medial compartment? Very good. By now all of you might have known, that is obturator nerve. That is obturator nerve. Okay, that is obturator nerve.